lots of colleagues waiting in the wings to come in and join the discussion this afternoon. And I really hope we're going to have a lively and interesting discussion on the topic of the impact of the pandemic on young people's mental health and well-being. Let me just begin by explaining how the session will run. So to begin with, we're going to hear from Martina Kane from the Health Foundation, and she's going to talk a little bit about their latest research on this very topic of mental health and well-being and young people during the pandemic. Then we're going to move on to the panel discussion, and we've got colleagues from across Catch-22 and a psychologist, and to have a really robust discussion after Martina's spoken. Really keen as ever for you to get involved in this session. You can see the Q&A box to the right hand side of your screen, and it's the session Q&A that we'll be using this afternoon. So again, type in your questions or comments or experiences, and we will make sure that we put that to the panel. Also, if you would like to ask a question live on the screen, you can click the request to share audio and video button. Again, that should be near the top of your screen, and then I can bring you onto the screen and you can interact directly with the panel. Really useful if you do that, if you can state your name and where you're from, so that other attendees can have that information. Okay, I think that's probably enough from me. Really keen to get cracking on this session. So let me introduce to you Martina. Martina Kane is Policy and Engagement Manager at the Health Foundation, where she currently leads the Young People's Future Health Inquiry. She's also a trained psychodynamic counsellor. You'll probably explain what that is, Martina, because I'm not okay with that terminology. And just a bit of background, the Health Foundation is a UK charity committed to bringing about better health and healthcare for people in the UK. Okay, Martina, over to you for your thoughts, please.
Yeah, thanks everybody. I'm just going to talk for a couple of minutes, and mostly I'm going to sort of set the scene, I think, for the conversation that we're going to have. And the scene really is, as you've been hearing as well this morning, that this pandemic has been a huge challenge for young people's mental health and well-being. So we did some analysis of the Understanding Society survey, and that showed a doubling of young people saying that they were unable to concentrate, and really worrying indicators across the board around general levels of unhappiness, feelings of worthlessness, all sorts of areas of young people's well-being being affected, sort of particularly during the lockdown periods of the pandemic. And this isn't just something that we are seeing affecting well-being, it also is something that we're seeing affecting some of the things further on the mental ill health spectrum. So what we're beginning to see coming through in referral data is increased referrals around young people's mental health, particularly concerns around referrals for eating disorders, and we're also seeing young people reporting to us that their access to mental health services is more difficult. So again, particularly during the periods of lockdown, the sort of face-to-face services that young people were getting through the NHS were much more difficult, but also some of the broader things that young people rely on sort of haven't been there in the same ways. The more informal interactions through youth services, for instance, were much more of a challenge in a virtual world. And part of the reason why this is worrying is that the picture before the pandemic for young people's mental health was actually quite worrying already. There was an increase in self-reported mental health concerns before 2020 from young people. And the Health Foundation spent a lot of time trying to situate some of the health concerns, not just of young people, but of all in its wider context. So all health, both physical and mental health, is influenced by things wider than just biology. They're influenced by where we live, by who we see, by what we do. These are all factors that lead to whether or not someone is leading a healthy life and is really able to thrive. And a lot of the work that I've been doing over the last few years on the Young People's Future Health Inquiry really looks at this age group. So we particularly look at the 12 to 24 age group, but that general period of coming from childhood into adulthood is a critical time for building the foundations of a healthy future. So as well as a really strong period of biological development, it's a huge period of brain development. And it's a massive period of social and emotional learning. And these years just really matter. They really can make a difference to a young person's long-term health. So, really coming of age during this period, we should be concerned about sort of what's happening and what the challenge has been to young people's social situations as a result of the pandemic. So as we look forward, it's really unknown. It's really unknown, sort of partly sort of the external context and what's going to be happening to the virus, but it's also unknown sort of how long-lasting some of these effects will be. So the wider context for young people over the last year or so has been so very different, and aspects of that will stay different. So we're already sort of seeing concerns about sort of what the job market is going to be like for young people, and that wider context again will have an impact on their mental health. And whilst we might expect some of the indicators I was talking about at the start, some of the wellbeing measures to be improving sort of as the world sort of begins to open up again, we don't know what the sustained impact is going to be, and we don't really know sort of what the long-term mental health impact is going to be for this cohort of young people. So, as I said, I was doing a sort of background and scene setting, introducing our research, and yeah, I'm going to hand back to Melissa to introduce the other panelists.
Thank you, Martina. That was a really helpful context. And as I was saying earlier to everyone, do type any comments, thoughts, experiences into the chat box. You can do that anonymously if you wish, and also the Q&A box. Okay, I'm going to invite the other panelists now onto the screen. So as they're sharing their audio and video, let me just give a brief intro to them. And perhaps if you are on the screen, you can just give a little wave when I say your name. So we've got Dr. Tania Rodrigues, and Tania is a consultant clinical psychologist with over 20 years experience working in forensic mental health services, prison services, and then in the community with children, young people and families. Thanks, and hi Tania, good to see you. We've also got Kirsty Magahy. I hope I pronounced that right, Kirsty. We had a practice beforehand. Kirsty is Assistant Director in Catch-22's Young People and Families Hub. And she oversees one of Catch-22's key sort of prevention, early intervention services called the Hive. And I'm sure Kirsty will explain a little bit about what the Hive does as we go through. And then also we've got Hannah Parker, and Hannah is a training manager with Catch-22. She's been with us for almost 3 years, and her role is responsible for really developing, producing and delivering various elements of the Catch-22 training offer. Now, Hannah has a background in cognitive behavioural therapeutic interventions with offenders, drug and alcohol recovery, and training of both staff and service users. So I think a really kind of experienced panel here. I want to just kick off. Oh, I can see Tania's not actually on the screen, but I'm sure she's going to join us shortly. So let's just kick off, and maybe I can come to you, Kirsty, first, if that's okay. Your reaction to kind of what Martina said. She set the scene there. What have you seen in terms of the impact on the young people you've worked with?
I think very much mirroring what Martina has said, and I think what we found, I think it's that that transition from being a young person into an adult, or a child into an adult, and going through that young person, and suddenly all those markers have gone. All those important stages have kind of been disregarded, and it's very much that young people are kind of in limbo. I feel that, they've been disproportionately kind of affected by COVID. They're the ones that are not always, but are kind of least vulnerable, the least at risk from this, and they're the ones that have been very much kind of affected by it. And I suppose across young people whose conditions have already been kind of exacerbated, we're seeing a lot of eating disorder increases. So yes, it does feel very unfair what they've been kind of put under from this.
Thanks, Kirsty. And just for the benefit of some people who may not be familiar with the Hive, could you just give a brief sort of overview of that service, and particularly because I know during the pandemic you've had to adapt quite a bit to how that model works?
A health and wellbeing service for young people in a city London borough. It's ethnically diverse area, but there's a huge amount. So we've been set up as a kind of alternative young people. So we have therapeutically informed one-to-one mentoring work, where we work alongside young people on any kind of issue that they present with, and we kind of go with them through kind of you need. Really looking at that, like where are they at? And also we've got a youth hub, a youth provision, where young people can kind of come in and make friends and take part in activities and really kind of have a community of life there, whereas often they maybe haven't come from that, or they've come from quite troubled backgrounds. So we obviously moved very quickly to an entirely virtual model, but we kept doing emergency one-to-one visits. And what we found is we prioritised 2 groups. We prioritised the people who were living in overcrowded accommodation and those who were completely socially isolated and living alone, and doing a lot of emergency visits to really kind of support those young people who were we saw an increase in suicidal ideation and self-harm, and just really trying to protect those and giving them kind of some structure and routine and just seeing just someone. And that was during the first lockdown. As we've gone forward, we've managed to open up more and more of our provision. So at the moment we're doing a fusion between virtual and face-to-face.
Yeah, excellent. Okay, thank you very much. And I know we're working to get Tania on board with us soon, but we'll carry on. We've got plenty of time for this discussion. I'll come to you in a minute, Hannah, because I want to talk about a little bit about the kind of people who are working directly with young people and their mental health and well-being. But just to put another question to Martina, and then perhaps you afterwards, Kirsty. You know, are there specific groups of young people that you've identified as suffering particularly during this pandemic? You know, is it possible to kind of group them? Martina, maybe you first on that one.
I mean, what we're seeing generally is that groups that there are concerns about, sort of that is generally magnified. So some of the concerns that we were seeing prior to the pandemic around mental health in young women seems to have been played out in the data that we've seen so far, and generally in part of the pieces around the wider context, we're really already seeing concerns around particularly disadvantaged groups of young people who were already in less stable employment, are often the ones who've been furloughed or have been out of work. So a lot of BAME young people, for instance, have been more likely to lose their jobs or be put on furlough. So sort of Kirsty mentioned some of that, the housing concerns in there. Again, quite often it's young people from poorer backgrounds who are the ones who are going to be living in overcrowded housing, and sort of the impact of sort of having to spend all day every day within a sort of not enough housing space for the people living there. Again, we sort of would expect to be seeing that having an impact on well-being, particularly as they're not able to be in the spaces where they would usually be.
No, absolutely, and I think what you're touching on there is the kind of social circumstances that surround a young person are likely to have, determined how affected they have been by this. Kirsty, I don't know if you want to pick up on that, particularly from the people you've been working with at the Hive.
Yes, I mean, certainly those who are in overcrowded accommodation, as Martina said, that they're the ones that, they're on top of each other. And then the other extreme, people living by themselves, or especially children that are leaving care children, or young people, people who are leaving care who don't have any kind of family structure around them. They become particularly vulnerable, particularly isolated. We found young people that were involved in kind of gang lifestyle, gang culture, and also been involved with the criminal justice system. Those who have kind of stepped away from that, they're kind of finding a different path. In actual fact, the fact that they'd lost their structure, lost their routine, were in overcrowded accommodation, didn't have any money, lost their job, and they were kind of sucked right back into it because they had a job, they have a purpose, they have something to do. Across the board, I think young people who've already got pre-existing kind of conditions were like massively exacerbated because of this.
No, absolutely. And yesterday, as you know, the theme was kind of education and employability, and we had some young people, who had kind of suffered with uncertainty in the job market during the pandemic, and obviously the knock-on effects of that are clear when it comes to mental health and well-being. Great. Let's park that sort of discussion for a little bit. I'm just really keen for people again to share in the chat or on Q&A about, because I know a lot of you work with young people directly. So are these themes, things that you've seen? What other impact have you seen? So anything you can share would be great. I'm going to now just move over to Hannah. Now, Hannah, I know you do a lot of work directly with people who are working with young people, so staff working with young people. Just give us a kind of sense of the importance of making sure that their mental health and well-being is good, so that can kind of pass on to the young people.
Yeah, absolutely. I mean, we've heard from Martina and Kirsty about how we know that young people have been disproportionately affected by COVID, and so obviously that's going to be changing the service user base that we work with. So, trying to kind of manage and help people, support people with different types of needs that we maybe kind of working with previously. And we already, in Catch-22 kind of staff as a whole, we already worked in some challenging circumstances with some really vulnerable people. So there was already, prior to COVID and the pandemic, there was already that need for us to take good care of each other and make sure that we're supporting each other around mental health. And what we're seeing is that, you know, yes, staff are kind of feeling the impact of that. So our frontline staff, you know, they're feeling, some of them, a greater responsibility to look after, you know, the young people who are especially vulnerable and made more vulnerable by COVID. So, you know, there's that pressure with do a good job, you know, and it also means that there's more demands on our staff. I mean, Catch-22 have done a fantastic job of keeping all of our support going throughout COVID. So whereas, you know, a lot of other people have experienced kind of, you know, either furlough or, you know, things slowing down, like an organization like Catch-22, we've really experienced the opposite of that. So actually, you know, people have been working a lot harder and feeling a lot more kind of strain. And I think the key thing for me that I've really noticed in my conversations, both with managers and with kind of individual staff, is that we're missing our normal kind of support, informal support systems. You know, the staff kind of are experiencing that isolation, some of them, and you know, we haven't got that kind of interaction within the office where we would provide that informal support that really keeps us going. And I think it's something that, you know, you don't really notice it until it's gone, and I think that's been a really impact for the staff. So yeah, a huge range of needs really all round.
Kind of really interesting. Welcome, Tania. Welcome back. Sorry for the technical difficulties. Let me just bring you up to speed a little bit. So Martina gave some kind of background, particularly in relation to some of the Health Foundation reports, looking at the impact of the pandemic on the mental health and wellbeing of young people. Kirsty's been talking about specifically the young people she's seen come through the Hive, you know, our service in Camden, and some of the kind of social circumstances that have really meant that some young people have been affected more than others. I wondered, from your perspective, you're a clinical psychologist, what's your take on this? You know, what have you seen in terms of young people and how they've been impacted, I guess, in terms of their mental health during this period?
Well, it's been interesting because I think we've seen a bit of a wave that in the first lockdown, what we have seen is that a lot of young people, specifically young people with particular difficulties with their mental health, actually experienced the lockdown as a positive experience, because to a degree, what they have experienced was a reduction in the kind of the level of stimuli around them. So there was a lot of stresses that actually were removed. So particularly children that were having difficulties at school, for example, and within peer groups, they actually felt a little bit more comfortable with the fact that they weren't exposing themselves to a lot of the risks that they were exposing themselves before. So we saw actually a slight improvement in the sense of children and young people feeling a level of well-being, also being at home and feeling that there was more focus on supporting them within their home environment, whether residential units, whether within foster care. With the second wave, then we saw the opposite, which was children then starting to feel more affected by the levels of loneliness and actually missing out on the kind of routine and the structure that they once had. So there was a bit of a wave that we've experienced. Depending on the types of mental health that we were dealing with, some people felt much better in the sense that other people started to understand their difficulties. So there's been something around a shared experience from parents, from teachers, from professionals within the support network that started to understand what it feels like to feel extremely anxious or what it feels like to feel depressed, because all of a sudden there was more exposure to these conversations. There was more focus on issues around self-care and well-being. And all of a sudden, it wasn't seen as we're talking about this because there's something wrong with you. We're talking about this because we are all experiencing something which is a commonality. So it's been interesting just to see how the world becoming more aware of the impact of COVID on all of us, to a degree, has helped young people come forward to say, actually, we've been experiencing this all along. Especially young people in care, for example, who of origin disrupted by already had this level of vulnerability and fragilities, all of a sudden realized that other young people and children that were still living in their own families were actually having very similar experiences to them. And that opened a dialogue and conversation, not just with young people, but also with professionals. So that's been an interesting thing to witness.
That's fascinating, Tania. There's some questions coming in, but I just want to pick up on 2 points that you made. So one is that idea of sort of waves, if you like, so different reactions depending on the sort of timing. And then the second one is this idea of sort of normalizing some of these issues. So I just wonder, Kirsty, Martina and Hannah, you know, is this, so on those 2 points, the idea of people reacting in different ways at different points, and then the idea, which is a positive, I guess, about normalizing some of these issues, is that something that you've picked up in your research, Martina? And then Kirsty and Hannah, have you seen that practically? Martina, maybe first.
So in terms of the different, different experiences, absolutely, we've looked at some of the high level data, but some of the qualitative interviews that we were doing with young people showed actually a really diverse range of experiences. And a lot of that sort of, again, sort of partly depending on social circumstances, but also partly depending on sort of factors individual to the young people, and also some of the sort of place-based factors. So, what things were like where they were, what they could access, what they couldn't access, sort of some of the things that sit around them. In terms of the broader conversation around mental health, I think it's definitely sort of, it's turned the world upside down. It's made people who've never thought about their mental health at all think about their mental health. And I think one of the things that I've seen since I've been working around this, sort of 10, 15 years ago, is actually that conversation just does seem to build and build. So when I sort of started thinking about this, there was the huge stigma around talking about mental health still existed in an enormous way. Whereas I think you can sort of see milestones sort of coming through and through, whereby now sort of conversations around mental health are far more normalized. But I think what does need to happen is there needs to be something that sits beyond just young people being able to say, this is what I'm experiencing, and then that being it, and that being expected to solve everything. And there needs to be something that is sitting not just at a professional level services, although that's absolutely needed as well, but that sort of understanding throughout the piece of what is good support, what can families do to emotionally support their young people sort of in the context that they're in this current situation, and what comes beyond that.
Yeah, really interesting. Kirsty, can I just come to you on that point about sort of young people reacting in different ways at different points during the pandemic? Is that something you noticed with the young people you work with?
Certainly, I think we found whenever there was a change in the government guidelines or a new announcement and the bank holidays, we found a massive spike in young people who were self-harming and having suicidal ideation. And it was almost like the reality of the situation of it and all that anxiety. So we find going into lockdown, young people were terribly anxious. And then when we started talking about unlocking, young people were in terrible anguish. And that was the same for the staff, actually. It was this kind of cycle that we sort of had to kind of, like a wave, like a boat, that we had to just keep kind of managing and going back to it and just kind of reassuring and kind of containing and holding, whether the staff or the young people, because everybody got very, very anxious. But at the moment, I think we're coming out, Britain's sort of slowly coming out of lockdown, and there's a huge amount of anxiety, a huge amount of like, what's going to happen? Is this over? Is this going to continue? What's going to go on? So I think at different points we found the need by young people. So in January, the Hive, we saw a spike in safeguarding around suicidal ideation, where we benchmarked it the year before that hadn't existed. And it was quite difficult to pinpoint, because obviously this is so, no one's been in this situation before. This is completely unprecedented. I know that's the buzzword, or was the buzzword at first, maybe not now, but yeah, so we have seen spikes, and especially around staff as well, picking up on Hannah's point as well. Just I think, even myself, I've struggled hugely over the last year. It's really, really hard, and it's like, actually you're struggling and trying to hold your family, you might be homeschooling, all of this, and then you're doing a really, really stressful job on the side trying to hold all that. It is really hard. And I think it is about our first point of call actually does need to be our staff. And like, are you okay? Because if you're okay, then you can help other people.
Yeah, thanks, Kirsty. Let's bring Hannah in at this point, and then we will move to some of the questions in the chat because they're coming through now, and I don't want to miss any of those out. But Hannah, I know you're heavily involved in kind of training as staff. You're a mental health first aider. You're training us all to kind of talk about these issues more. So Tania's point about kind of normalising it, opening up those conversations. I mean, is that something you've witnessed, and how are you able to kind of build on that, I guess?
Yeah, I definitely think it has, normalised it a lot more, and obviously we deliver various kind of bits of training within Catch 22 that hopefully kind of helps with that. And as a mental health first aider, one of those one-to-one interactions that about kind of promoting that kind of mentally healthy workplace culture, where the conversations around how we are feeling are much more normalised, so that everybody kind of feels okay and feels safe to be able to talk about that. And I think kind of just really echoing kind of what Kirsty was saying there about the staff and how we have seen those different kind of impacts. I think, I haven't met anybody kind of in all the sort of virtual settings over the last 12 months. I haven't met anybody who hasn't been impacted, but all of those impacts have been ever so slightly different for people, so we've had some of our staff adjusting to the isolation aspect because they're remote working, and then we've had meetings as mental health first aiders. We've talked about being concerned about then when things start to unlock and return to normal, and staff having concerns then about just everyday things that then become quite anxiety inducing, the commute into work, kind of what happens when I come back into the office, and all of those practical types of things. And then obviously we've had some of our staff who continued to go into their workplaces kind of throughout the pandemic, making our services go in, who then not only maybe have those concerns around like their own health, but then maybe, kind of Kirsty mentioned family as well. So, then kind of going back into your home where your family is when you're in a workplace, or if you're isolated, but juggling the homeschooling. So we have seen a variety of impacts, I think, kind of, on our staff, but we are hearing about these impacts and people are talking about those impacts and how it is affecting them. And that's a really kind of positive thing that I really hope kind of, as things do slowly get steadily back to our new normal or whatever normal we're going to have, I hope those conversations will continue and people kind of as open and as vocal about that, because I think that's a really positive and healthy thing for our workforce.
Absolutely, thanks, Hannah. And we'll pick up that point about kind of moving forward and what we see in terms of the future. Let me turn to the Q&A and chat box now. Someone's saying, fantastic to hear someone talking about the impact that this has on frontline staff. So thanks, Hannah. Key that frontline staff are supporting their mental health to enable them to then help their young people. So good point there. Okay, question here talking about social media. So this person's asking, we've all seen the influence social media can have on young people. Do the panel feel that some social media content has exacerbated mental health deterioration in young people during lockdown? Let me come to Tania first on that one, if that's okay.
Absolutely. Shadow of a doubt. One of the things that, and it's not just around the pandemic, actually, if we do a bit of a retrospective over the last 2 years, there's been so much stuff happening on the media, from the George Floyd death, the Breonna Taylor, the fires in Australia. There's been so much around a lot of movements that kind of spread a sense of unsafe and uncertainty within the world, really. And young people have become much more aware of political issues happening around them. So this has a massive impact. It also affects young people in terms of how they become, to a degree, more vulnerable, for example, to becoming affiliated with certain groups. They then start to belong to a way of thinking or feel part of a particular movement in some respect. So the pandemic has had a massive impact because the media focus on all the negatives. So everything that we've heard about is always about the number of deaths, is about the amount of people admitted to hospital. It's about all the negative things. There's very little around the positives. And other than, you know, the wave of solidarity that happened, really helpful in terms of young people accepting this notion of kindness, which for young people, kindness is still a bit of a fluffy concept. When we start talking about do a bit of self-care, take time for yourself, it's not something that they're particularly fond of, you know. But young people spend most of their time on social media. And so to be exposed to this kind of narrative on a day in break, and also on top of that, the isolation from the normal peer groups, it does have a massive impact in terms of fear. And it's not just fear about what's happening outside, it's what's happening in my home with my parents, with my grandparents, with myself. And one of the things that we've become more aware of in the work that we have done in our project was really a lot of young people starting to question this idea of mortality, which is not something that young people tend to be thinking about very often, you know, that it's imminent, that it could happen at any time. And so there was more discussions around this idea of, you know, we are experiencing something which is similar to what we've heard about when there were wars on the world, you know, in places of conflict. So even though you don't see the fear, even though you don't see the danger outside, which makes it even more surreal, you're surrounded by this feeling of danger, but you can't see it. And so everything becomes a little bit uncertain. That has had a massive impact. And because parents are exposed to that too, what we have lacked with the pandemic is that buffer that parents can say, oh, it's not so bad, let's talk about this, or teachers or whoever, because the media is saying, actually, it is that bad. So yes, I think we've all experienced that. I think young people, because they are perhaps more attuned to social media than maybe some of us older generation, they are much more aware of what's going on. So yeah, for sure.
Thanks, Tania. Kirsty, Martina, Hannah, would any of you like to come in on that about the impact of social media? Martina, and then Kirsty.
Just to add sort of a layer of nuance to it, I think we are also seeing concerns sort of at the other end of the spectrum around sort of digital isolation, really. So I think one thing to bear in mind in this context is that, you know, whilst the pandemic has happened now, it has there have been real positives that have come out of that being in such an internetly connected world. So the ability to keep doing schoolwork online, for instance, has kept up a level of education, and young people being able to connect with their classmates or, you know, their peer group virtually, and connect with their services virtually, sort of has given them something, not to the level that it would have been otherwise, but it has been there, and it has been a really important outlet for a number of the young people that sort of we were speaking to. So the importance of being able to send messages to their friends, the importance of being able to, you know, film videos and upload them, those kinds of things were a really important coping mechanisms for a lot of young people. So I think I think there's a balance to it. So it's not as simple as just saying the sort of the fear that came through and all of the content, which is undoubtedly sort of having an effect. There is a balance to it too.
I think that, yeah, it's a really interesting point, and certainly at Catch-22, and Kirsty, you may sort of back me up on this, but we've been doing some work on digital exclusion, you know, and there are many young people who as soon as we were thrown into lockdown, didn't have devices, didn't have data. Often, again, those sort of most vulnerable young people and children, and again that sort of prompted those feelings of isolation and not being able to connect with others or do schoolwork and things. So I guess, you know, there's many levels to this. Kirsty, your views on social media?
I think it's really interesting hearing kind of both sides there, and I think obviously when we went to a virtual delivery model, we've got our youth hub, so we delivered that virtual, and I remember somebody questioning it, saying, well, you're not encouraging young people to spend even more time online, and we were like, well, yes, but it's about what are they using that time for? Is it useful? Is it productive? Does it make you happy? are you gaining something from it? So a lot of young people use the kind of platform and just go on there, have that distraction, learning, socializing. And I think, as Martina says, there's loads of people who are using it to really connect out to young people and to have that. But on the flip side, you know, we've got young people who are there, you know, 3, 4, 5 o'clock in the morning, just scrolling through Instagram or Snapchat or whatever it is. So it's really unhealthy. And I suppose we've all become digital. Our entire lives are now living from the screen. This entire conference is by a screen. And it's very difficult often to turn around and say to young people or kids, well, you can't be looking at a screen. No. So I think it's about how do we make sure that you being online is healthy and good for you, and what do you get out of it, instead of being bombarded by, you know, misery. You do turn on the news, there's nothing happy, there's nothing joyful happening in the world. So it's about what do we do to create that kind of a space online where you can get some enjoyment out of that, and it's something positive.
Yeah, great. Thank you, Kirsty. Tania, do you want to come back in on that point?
Yeah, I was just going to say, actually, on that point, one of the benefits of I guess, social media and I guess access to digital has been for young people in secure services, in the secure state, which are really struggling to communicate with their families and to have contact with their families. And one of the things that we have seen is that, unfortunately, we're dealing with lockdown, but when you're working with young people in secure services, usually the ways to manage risk is by imposing even more restrictive practices. And so that disconnect from people becomes even greater. Disconnected, and then the measures that we have to put in place to manage and support and keep young is again going into restrictive practice. The only contact with the outside world was very much via digital platforms, and we have made really good use of those to bring families in to be part of particular events within the family that they couldn't have been part of otherwise. So that there is absolutely a very positive way of looking at how we've used the digital era during the pandemic. I think my concern was more around what information we were being exposed to, and the lack of the balance of the positive, of the good things that were also happening. But without a shadow of a doubt, I think for all of us, without the technology, we wouldn't have been able to maintain a lot of the contact that we've had with young people and their families. So it's been an absolute fantastic way of being able to communicate and to connect. Though it's not the same, it has allowed us to be in touch with people and to hold people in mind, which is really hard to do when you're just completely disconnected. So yeah, absolutely.
Great, thanks. Really, really interesting discussion there. Again, just to encourage people, any more questions, put them in the chat, and we've got about 10 minutes or so left. So a question here asking, when we get back to something resembling normality, is there going to be a wave of need for support? So in healthcare, the wave is probably coming, but what do you think is the impact on the social and youth sector? And this is from a colleague in Finland, I recognise his name. So who wants to come in first? Because everyone's nodding. I don't know, Martina?
So some of my colleagues elsewhere in the Health Foundation are doing sort of quite a lot of work looking at some of the sort of things that we might be able to predict, particularly on the healthcare side, and some of the things that we might be able to predict on the mental health side. And yes, sort of broadly speaking, we are predicting that there is going to be an increase in sort of people reaching forward, but it's just really difficult to quantify sort of what that is going to be, at what level it's going to be, and how sort of, you know, how people are going to be able to bounce back from this. So to what extent is this going to be sort of, you know, something long lasting and fundamental that is going to sort of have really sort of deep and long lasting impacts, or what, you know, and what sense, and for what groups of young people this is going to be something that they are able to, you know, sort of absorb into their experience and really sort of, you know, pull on and you know, draw from the rest of their lives.
Kirsty?
Right, and also I recognise that name. Hello, Lassie. I can see that. I think we've kind of discussed this quite at length at Hive on what the expectation is, and I suspect what will happen is people are going to go out and go, yeah, we're free, we're out, and I think suddenly we're going to hit this. The reality is going to hit, and I think there is going to be huge amounts of need. and people are going to come forward, and people are going to have to process what we've been through, and we're doing that as a nation, as individuals, and people that we're supporting. We've had this collective trauma that the world's never gone through, well, not for a very, very long time, and it's how we're all going to work together. So I think there's going to be a big party, and then everything is going to crash down.
That's yeah. Oh, okay, Tania, what do you think about this? I'll come to you as well for your thoughts after Tania's spoken.
As a clinical psychologist, the thing that I'm always interested in is to look at what is the repercussion of this within the cultural context of the society that we live in, because what we do know is that, yes, there's going to be a long-term impact. That long-term impact is going to be different with regards to place, geography, race, gender. We're going to see some communities being far more impacted than others. We're going to see some young people actually bouncing back from this and actually having this massive developmental growth because of the pandemic and because of what they and the opportunities that they were generated through that. We're going to see some families whose relationships have absolutely been strengthened through the pandemic because they've come together, because they were all together. But then we're also going to see the other families that actually everything is just broken down because, you know, there wasn't, you know, financially they weren't viable things, you know, all of these other pressures. So it's going to, we're going to need to take an approach in terms of looking at the impact in terms of intergenerational trauma. So we need to look at what is it that parents at this moment in time that were already struggling to make ends meet managed to support young people during a time of the pandemic, and how these young people have had support or lack of, and how they're going to then fare in comparison to others when in the next 10 years, for example. So I think there's going to be differences in what we're going to see overall. I think the ACEs research at a time like this, the Adversity Childhood Experiences research, really brings to light the impact of, or the need for us to be aware of the impact of the social and the emotional and the physical when we're looking at what is going to be needed next. Because I think there will be a lot of young people, like Kirsty was saying. I think for most, or for a great majority of us, we're going to go out and we're going to almost want to take back time. We're going to do as much as we can in as little shorter period of time as possible to compensate for what we couldn't have done.
Actually, we won't have the mechanisms to adjust to all of that. And then we will have young people that are going to find it much harder to get back to normality.
And it's been really interesting, you know, as a parent, for example, to see how my kids have responded to that. And one of my kids, if I was to give him the option not to go back to school, he probably would take it. He probably would choose not to go back to school and do everything online and create his own structure. And if I'm really honest, I hadn't realized how much his way of looking at life and structuring his time and doing things was different from all the other kids in the family. So there's been so much awareness and so much that we've learned that I think we have a more trauma-informed approach. I think we need to invest more and more in our frontline staff, in our teams, in terms of, it's not just around training them, it's around supporting them to be aware of the interplay between what we our own baggage, because we've got our families, we've had losses in our, it plays out with the young people and the families that we're working with, and then how do we create some kind of approach that is more accepting of the difficulties rather than pathologizing those difficulties. I think there's going to be a need for a mindset in how we work moving forward, with a much greater focus on the political aspect, on the financial aspect, on the social aspect, and trying to support young people, not by fixing them, but by looking at what are we doing around them to create an environment that is going to support them better in the future.
With my mic off. Do you have anything to add on that one before we move on to looking to the future?
Yeah, just really quickly, kind of adding on really and picking up on kind of what Kirsty said, as well as lots of what Tania was just saying. We know that obviously there's going to be kind of a long lasting impact, and we're going to see some of that in the short term, as well as kind of, you know, as the months and years progress. And I just think it's really, from an overall catch-22 perspective, for us really to be mindful that as Tania said, like the young people and the families that we work with, as that is all happening for them, actually that might be happening for our staff as well. And actually just remembering that our staff not only are trying to support people going through that sort of transition back into our new normal, as well as managing that transition in their own lives as well. And I think that's something where we need to maybe start doing that work now, to have the support systems in place. And, you know, whether that's training, or like Tania was saying, not just training, but kind of giving people the support to be able to manage that kind of, you know, really sort of testing period that might be coming up, where we're very much sort of balancing our work and our personal kind of lives as we come out of the other side of the pandemic. So
absolutely, yeah, great, thank you, Hannah. Okay, we've got a couple of minutes left, and kind of 2 questions to address. So the first one is asking about what practical advice do you have for how we can reach out to young people if we're concerned that they might be struggling with their mental health? How can we signpost them to the right support? What I'm going to ask you all to do is, if you've got useful links or anything like that, if you can maybe pop them into the chat. Obviously, I think we're going to be predominantly UK based, the links we're going to be posting, but I know there's a lot of people from the UK listening. So if you wouldn't mind doing that, we can share some of these afterwards. The question I'd really like you to answer, because I think this will be applicable across, you know, whatever government we're under. My colleague here from our Young People and Families team saying, my concern is that the impact of this could last for years. Currently, there's welcome additional money and resources available, certainly in the UK, but this won't last forever. What is the single most helpful thing we could put in place now to support young people for the long haul? Quite a profound question there. So I'll just give you a bit of time to kind of think about that, but I think that would be a quite nice note to end on. So what you think, the 1 or 2 things that could be put in place now to really support young people for the long haul? You're all nodding and looking sort of like you might be ready to speak. So who'd like to kick off on that? Tania? Oh, Hannah, off you go. Thank you.
I'll start us off. I mean, I don't, you know, the single kind of most helpful thing to equip our staff, basically kind of with the confidence, with the support, with the skills that they need, kind of both to be able to, you know, support each other kind of as colleagues and provide that peer support, as well as, you know, having that confidence to be able to support this, you know, these additional needs that we might find in our young people that we're working with in our service user base, and to have able to support people more effectively kind of for the months and years to come around their mental health. So really for me, it's just kind of providing that, whether that's training, support, or probably kind of an interplay between all of it, to be honest, you know, the training, support and confidence for staff, you know, manage what's coming forward.
Thank you, Hannah. Yeah, colleague here saying resilience circles, and I know there's a workshop this afternoon on resilience circles, so at 2:30. So if you're interested, join that. Martina, can I come to you on that point?
I'm going to go to the other end of the scale and sort of think national policy making. I think one of the most important things that could happen is a real sort of step change in the understanding of this age group, and this age group being so important and sort of foundational for the rest of lives, really, and how you know, the policy making around this age group just shouldn't be so focused on entirely on academic attainment. It should take that more holistic approach. It should take that approach that understands sort of young people as sort of developing human beings that are going to sort of go on to you know, to have lives for which the foundations have been laid at this point, and how at a policy level all of that needs to complement each other and can't sort of, you know, keep pulling in the different directions in the way that it has.
Yeah, absolutely. Kirsty, and then Tania to finish us off.
I think definitely completely echoing what Martina said completely, but to add to that, physical spaces, I'm all about a physical space. I think a space where young people can go to, they can get support, whatever that space is useful, but it's something that's really for them. And I think so many of our youth centres, community places have been, stripped away and taken away, and there is nowhere to go to be part of that community. So I think that is crucially important for people now leaving their houses. Where do they go? They need to be together. We need to create that.
Thank you, Kirsty. And finally, Tania.
I think everybody said everything that I'm thinking about, really, but the key word for me around that is connection, and connection at different levels. So we need to create a sense of connection for young people, which starts with meaningful relationships with carers or people that they feel are going to be there to protect and to safeguard them. We need to create a sense of connection with those people so that young people start to develop a pattern of attachments that are healthier, so that when they are looking for connections, they're looking for positive connections. And I guess in order for us to do that, we have to have a policy that sees young people at the center of what different areas of connection, because there's connection to the family, there's connection to peers, and to connect with peers, you need to have spaces that are safe, that are meaningful, that are interesting. We need to have connection with education. We need to have connection with employment. So connection for me is at the core of all of that. And it brings us back to connection with the support staff in the front with as well. So connection is the one thing, and I mean connection in the sense of emotional connection, because the one thing that is going to help us be resilient in the future is if we have developed a pattern of connection to others that is healthy. And if that is missing from the beginning, from the offset, then it puts us in a really vulnerable position for the future. So for me, that's key.
Wonderful, thank you. And I think a really good way of rounding that off. Thank you so much, Tania. Thank you, Kirsty. Thank you, Martina. Thank you, Hannah. A really interesting discussion. Thank you to everyone who posted questions and joined.